I'm just going to give everybody a few more minutes before we start. Hi, everyone. It's 3 p.m., so we will get started with the presentation. A little introduction. My name is Kayla Thornton. I am a specialized case manager for Advocacy Links Case Management. My role is focused on older adults and dementia-related issues. I have been in this field for about 8 years now and have worked directly and indirectly with many individuals with intellectual and developmental disabilities. First, I began as a caregiver when I was 18 years old and did this for about 4 years before transitioning into a program coordinator for the same company. I stayed in that role for about 2 years, and as of January 2017, I began as a case manager with Advocacy Links. Here's where I really began to build relationships with my older consumers and really engage in the care that they receive. As many of our consumers get older, care and knowledge become very important and critical to their health. It is important to understand that although our individuals have a disability, many of them go through the same aging process as the general population. I want to take some time today to discuss menopause in older women, as well as some of the differentiations that occur with the disabled population. Unfortunately, there is a lack of research conducted on menopause for individuals with disabilities. However, I will try in this presentation to outline some of the limited research that is available. Also, keep in mind that there is a chat box to the side of the screen, and at any time you have any questions or comments, please feel free to type it in, and I will try to answer them or address them to the best of my ability after the presentation. So during the presentation, we are going to discuss what exactly is menopause, various symptoms, the different phases, some complications, and a few treatments. There will be a few videos throughout the presentation that will outline some of the topics that we discuss, And again, we will also have time for questions at the end of the presentation. To begin, we are going to start with what exactly is menopause. So menopause is defined as the end of the menstrual cycle for a woman. At this time, the ovaries produce lower levels or stop producing altogether the hormones estrogen and progesterone. Estrogen is a steroid hormone that carries physiological messages to a woman's organs, each one of those being different. It is referred to as the female hormone because it promotes growth and health of the reproductive organs. Progesterone is produced by the ovaries, and its job is to prepare the lining of the uterus for a fertilized egg, and it also helps to maintain pregnancy. These two hormones play an important role in the aging of women and accounts for mostly all of the changes as you will see throughout the presentation. Menopause is the permanent end to the reproductive life, but it is completely natural and normal. Women begin menopause when their menstrual cycle ceases to exist for 12 consecutive months. On average, menopause begins at around 51 years old, but may occur as early as 30 or as late as 60. Beginning menopause before the age of 40 is known as pathologic menopause and occurs in only about 5% of women. Menopause beginning after the age of 55 is considered late onset. One differentiation that I found is for women with Down syndrome, as menopause generally begins at an earlier age, beginning on average 5 years earlier. Some individuals have even begun as early as 10 years. One study that I found that was conducted concluded that menopause was twice as high to begin earlier in individuals with Down syndrome than any other disability. This is because individuals with Down syndrome age faster than other disabilities, with an expected lifespan on average at about 60 years old. The increase in aging accounts for the early start to menopause. We want to remember that menopause does not happen overnight, but it is a gradual process with 3 phases. The first phase is the perimenopause phase, the second is menopause, and the final phase is postmenopause. Individuals with Down syndrome and other disabilities will go through the same stages as the normal population. There is a stage that is used to describe the time before menopause occurs, called premenopause, and this refers to a woman's first menstrual cycle to their last. We won't spend much time on this as it does not pertain to the actual menopause process rather than the reproductive stages. Perimenopause occurs roughly 3 to 5 years prior to menopause actually starting. Menopause begins after you've missed your 12th consecutive period, and postmenopause begins 1 year after your last period until the end of a woman's life. We are now going to talk a little bit about each of the phases in a bit more detail. Premenopause is a woman's reproductive life, and it is often used interchangeably with perimenopause. Not that the two phases are similar, rather women just sometimes get the terms mixed up when they're describing their stages. At this stage, women have not experienced any menopausal symptoms and are completely fertile. Women can and do experience PMS symptoms associated with their actual menstrual cycle, such as irritability, cramping, headaches, and other symptoms. Perimenopause is the first official stage and occurs at approximately 47 years of age in the general population and lasts about 4 years. As I stated earlier, individuals with Down syndrome can begin earlier, which usually starts in their 30s. During perimenopause, your menstrual cycle will still occur, but will start to become irregular. Some women have had longer, shorter, heavier, or lighter periods. During this phase, women can still become pregnant, but the body begins to start producing less estrogen and progesterone, and the ovaries stop releasing eggs. During menopause, it usually occurs around the age of 51 for the general population and between 40 to 45 for individuals with Down syndrome. During this phase, a woman cannot become pregnant and is known as infertile. It is also a time when the symptoms are most heightened, and we will discuss symptoms later in the presentation. Postmenopause is the final stage and occurs until the end of a woman's life. During this time, the symptoms begin to ease slowly, and some women do start to regain some energy. Unfortunately, after menopause, as women begin to be at an increased risk of health diseases such as osteoporosis, heart disease, and vaginal issues. This highlights a huge issue for individuals with disabilities who already struggle with health conditions prior to menopause. As many of you are aware, many of our consumers or individuals that we care for already possess health conditions or complications based on their disability. After menopause, the body becomes at an increased risk of these complications, or they can complicate conditions that are already present. We will spend some time later in the presentation discussing some major concerns in this area and how they relate to different conditions and disorders. Next, I'd like to discuss some of the symptoms associated with menopause and how they affect women. At any of the stages, women can experience hot flashes, tiredness, aches, pains, depression, food cravings, mood swings, loss of libido, vaginal dryness, and night sweats. There are an abundance of other symptoms that are present during all of the stages of menopause, but not all women will experience all of these symptoms, and some women only experience a select few. Hot flashes have generally been used as the defining term when people discuss menopause. It can be described as a sudden warmth sensation or heat that spreads over the body until your face has super flushes. It usually begins in the chest. At this time, a woman's face can be completely red, and the flushes can be described as delicate for some or a sensation of engulfing flames for others. The reason for this is the fluctuation of hormones estrogen and progesterone. As previously discussed, as women age, the supply of estrogen decreases, which results in hormonal imbalances. About 75 to 85% of women will experience hot flashes during menopause. Similarly, night sweats are severe hot flashes that occur during sleep and are accompanied by intense bouts of sweat. Individuals with Down syndrome and other disabilities can have a hard time distinguishing between a hot flash and just a general feeling of being hot. They also can have a hard time describing their symptoms, which can make it hard to diagnose exactly when menopause is occurring. Compared to the general population, the emotional symptoms of menopause, such as anxiety, irritability, or depression, are often dismissed as challenging behavior caused by an individual's disability rather than a physiological condition. This is where the issue arises about doctors, families, caregivers, and other staff not ensuring that individuals with disabilities are informed about changes that will occur in their bodies as they get older. Shirley Masuda is a researcher from Dawn, and she stated that women with disabilities are not receiving adequate attention because of what she calls the disability castration syndrome. Masuda stated that once a woman becomes disabled, she's not supposed to be sexual anymore. Doctors, friends, and even family at times stop talking about any sexual related things, menstruation and menopause falling into that category. Society doesn't picture a person with a disability as being sexual in a sense, hence the lack of discussion about their bodies. Once this notion is put into place, those individuals become less and less informed about hormonal changes that will occur as they get older. This leaves a whole population of people unaware of symptoms that associate with menopause. And again, it is easy for symptoms such as depression, irritability, and anxiety to be viewed as behavioral concerns rather than a change in hormonal functions in adults with disabilities. It is our job as advocates to ensure that our consumers and loved ones are informed about the changes that they will be facing. Because individuals with disabilities have a harder time describing changes, it is essential that they are informed about the possibilities. The better informed a consumer is, the easier they will be able to recognize their own symptoms. It is also important that these individuals be educated prior to menopause affecting them. It can be hard for them to be socially aware of these changes, so the information must be clear and concise to ensure that they have a full understanding of the process of menopause. This may mean that the topic is revisited numerous times as the individual ages. Therapists, doctors, staff, friends, and family are some of the people that should be ensuring that they are informed about the changes that they will be facing. Next, we are going to discuss a major challenge in diagnosing individuals with disabilities with menopause due to underlying dual symptoms. We all know and are aware that many of our consumers suffer from other chronic conditions, whether it be physical, emotional, or mental, along with their disability. Some common symptoms or conditions include sleep disorders, depression, incontinence, anxiety, irritability, headaches, joint pain, digestive issues, muscle tensions, and osteoporosis. These conditions not only make it harder to diagnose a woman with menopause, but it also poses a risk for postmenopausal complications. For example, individuals with Down syndrome are more susceptible to osteoporosis due to accelerated aging, which affects the bones. Thus, after menopause, the risk of complications greatly increase when hormonal levels are at their lowest. Digestive issues such as constipation occur, and urinary issues such as increased frequency take place after menopause. These dual symptoms or conditions that are already occurring in some of our consumers become questioned of how does someone know when menopause is really occurring. Obviously, there are hormone levels that can be done, and the absence of periods become a defining factor. However, more importantly, knowing, listening, and educating your consumer is vital during this time. Being able to distinguish different factors and behaviors that are out of the ordinary for your consumer is the best way to understand when something is changing. This goes back to how important it is to give all women a concise reality of what they should expect when menopause approaches. Continuing our discussion on the risks of menopause, we are going to outline a few conditions that impact individuals with disabilities. Over half of all deaths for women over the age of 50 are due to heart disease. Preliminary research suggests that it may be the leading cause of death for individuals with disabilities. Menopause can increase a woman's cholesterol level, which can lead to greater risk of heart disease or stroke. We discussed earlier how osteoporosis and menopause correlate with a decrease in estrogen. This is because estrogen helps to maintain bone density, and the low levels of this hormone put stress on the bones. For older women with cerebral palsy or other neuromuscular conditions, incontinence can be a result of aging and their physical disability due to weakened pelvic muscles and the thinning of the urethra. The leakage is known as stress incontinence and is common during the perimenopausal stage. The main point I'm wanting to address here is recognizing that menopause is an important part of a woman's life and comes with many changes that we need to be made aware of. Women with disabilities and their caregivers need to pay close attention to the risks associated with the disability and the risks associated with menopause in order to identify any changes. Although the process of menopause is virtually the same for all women across the board, disabilities pose a threat to an increased risk of many factors as we went over and will continue to address. For women with autism, I found that during the perimenopausal phase, they can see an increase in hypersensitivity, foggy thinking, difficulty with temperature regulation, muscle pain, executive function challenges, and trouble sleeping, which are often characteristics of autism itself for some women. In addition to the symptoms, some women on the autism spectrum often reported feeling afraid that they will not be able to function independently due to the symptoms. Another issue is that some autistic women may be so accustomed to anxiety or depression or any physical pain that it can be hard for them to recognize what's normal and when to ask for help. Coss Michaels is an autism speaker, and she stated that some autistic women do not fully regain their processing speed once menopausal symptoms go away. She had also had some concerns about the long-term effects of SSRIs causing complications with osteoporosis. She believes that with extended research, more information will come to light about the differentiations between autistic women and the general population. Next, we are going to discuss areas that do have some research conducted. The first one is epilepsy and the effects of menopause on seizure activity. There is evidence that some individuals with epilepsy can exhibit menopause a decade earlier than the normal population. especially if they suffer from catamenial epilepsy or have high seizure rates. Catamenial epilepsy is a worsening of seizures near the time of menstruation, and some doctors think that the two important parts of the brain that contribute to this are the hypothalamus and the pituitary gland. The hypothalamus is responsible for coordinating the autonomic nervous system and the pituitary gland. The pituitary gland controls our body's temperature, our thirst, hunger, and our emotional activity. Hormones estrogen and progesterone can affect seizures, so it is expected that when these hormones change during menopause, so do seizure activity. Generally, estrogen is known to increase seizures activity, while progesterone is known to decrease seizure activity. When the two diminish at menopause, it can cause seizures to become unpredictable. I found in a study that a third of women who had epilepsy before menopause reported no change in their seizures. A slightly larger reported worsening of seizure activity, and a slightly smaller number reported improvement in their seizures. Another study found that women who had a pattern of catamenial epilepsy were more likely to have fewer seizures after menopause, but had an increase in seizure activity during the period just before menopause. The effects of menopause, again, have limited research for individuals with epilepsy. However, it is an area that needs to take precaution and really monitor seizure activity during the time that menopause occurs. A condition that some of our consumers will face as they get older is dementia or some type of memory loss. Lapses in memory can be attributed to the normal aging process. However, it can also be a sign of dementia or Alzheimer's due to changes in the brain. As a woman's body ages and goes through menopause, estrogen no longer participates in brain functions as it normally had, which can cause occasional memory lapses, resulting in short-term memory loss. The decrease in estrogen can also lead to anxiety, depression, hot flashes, and sleep disturbances, and all of these can contribute to memory loss. If the memory loss is occurring during the time of menopause, it is likely due to the hormonal changes. Some women do become anxious that it is a sign of dementia. However, by definition, dementia is an impairment of thinking that interferes with a person's ability to do things that she previously was able to do. Some common symptoms associated with dementia are memory loss, difficulty communicating, inability to learn a new skill or remember new information, difficulty with planning or organizing, difficulty with coordination and motor functions, inability to reason, and hallucinations. Here's a short video that kind of talks about memory loss during menopause and how it compares to dementia. Oops, I apologize for that. I don't know what happened there. Okay, well, it looks like you guys cannot hear the video. Let me see if Okay, we may have to skip a few of the videos in the presentation as you guys cannot hear the sound. Okay. We will move on. So basically in her video, she was describing that often people believe that once they start not remembering certain things, that it's automatically dementia or Alzheimer's. And she just wanted to basically relay that there's more than one symptom revolved around dementia or Alzheimer's, and usually just little overlaps or brain fog is just part of the aging process and just can be part of menopause. So obviously you guys didn't see the video, but there are definitely some symptoms that overlap with menopause, but memory loss is not the only symptom. Occasional forgetfulness or feeling as if your brain is foggy is more associated with menopause than dementia. But people do have concerns, and if you're one of them, you can always talk with your doctor if symptoms are unclear or if there are other complications along with the memory loss. So another condition that, according to the CDC, individuals with disabilities are at a greater risk for is actually diabetes. With hormone fluctuations that come during menopause, it can make it difficult for women to keep their blood sugar stable. Women can struggle with identifying if a sudden body temperature change is due to an insulin-related problem or a hormone-related hot flash. Some other complications associated with menopause and diabetes are obviously changes in blood sugar level, weight gain, infection, and sleep problems. Some women gain weight during and after menopause, which affects their needed dosage for medication. High blood sugar levels have also been contributed to UTIs and vaginal infections because after menopause, the drop in estrogen makes it easier for infections to occur. Sleep deprivation can also pose difficulty in managing blood sugar levels, which is a side effect of menopause for some women. Doctors do recommend that during menopause, women check their blood sugar levels more often than usual during the day and talk with their doctors about adjusting medications if needed. So far we have discussed what menopause was, the phases and many complications associated with menopause. Now we're going to spend some time discussing treatment options and how women can cope with this drastic change in their life. So there are two main types of treatments that we're going to review, which are non-hormonal and hormonal. When discussing non-hormonal treatments, we're going to focus on SSRIs, a woman's diet, lifestyle changes, vitamins, oils, and herbal remedies. And then hormone replacement therapy is a form of hormonal treatment that is used to cope with menopause, and we're going to discuss how estrogen and progesterone play a part in this treatment along with the risks. As many of you are aware, some of our consumers face depression due to their disability. It is also known to coexist with many autistic individuals. There are factors that increase the risk of becoming depressed, such as lack of mobility, accessibility issues, social barriers and isolation, employment, and poor health. Our consumers generally take medications to deal with their depression, some including Prozac, Zoloft, Paxil, Celexa, Wellbutrin. One study performed concluded that SSRIs, such as those listed above, posed a heightened risk for bone fractures. This, paired with the already increased risk of bone issues after menopause, is certainly something to consider. SSRIs are a common treatment that is used for side effects of menopause, such as depression, hot flashes, irritability, and anxiety. Another study that was published in JAMA tested the effectiveness of SSRIs on hot flashes and found that 55% of women that took the medication exhibited lower episodes of hot flashes than before. It was mentioned that more research needed to be conducted as there were many different types of SSRIs, and this particular study focused on one type. Again, research has shown that although it is a possibility that SSRIs increase the risk of fractures for a short period of time, the effectiveness of diminishing menopausal symptoms may outweigh the risks. Again, it is important to review this with your doctor, especially if you are already taking SSRIs. A woman's diet can play an important role in menopause. To lessen the severity of hot flashes, doctors do recommend that women going through menopause avoid caffeine, spicy food, and alcohol. Women can incorporate plant estrogen into their diet, which can assist with reducing hot flashes. And examples of these are soybeans, chickpeas, lentils, fruits, vegetables, and flaxseed. Again, weight gain is a serious issue during menopause and can attribute to the severity and frequency of symptoms. Women should ensure that they have enough calcium, iron, and fiber in their diets as well. We discussed earlier about the increased risks of heart disease after menopause and its association with the disabled population. Women should make sure that they are not consuming high amounts of trans fat and their cholesterol intake is at a reasonable level, because this all can contribute to poor heart health. So making sure that our consumers and loved ones are having a well-balanced, healthy diet can play a huge role in ensuring that they sail through menopause more comfortably. As far as lifestyle changes go, there are some ways that women, again, can lessen the severity of symptoms and cope with changes that they will go through. Reducing the temperature in a room to at least 65 degrees, dressing in layers, or using a fan while sleeping or awake can help women deal with hot flashes. Being overweight tends to contribute to an increased amount of hot flashes, so incorporating exercise into the diet can not only help with their overall health, but it can also decrease hot flashes. Smoking was another barrier that was contributing to more hot flashes, but it also increases cardiovascular risks. There are many changes that a woman can make in her life to help her cope or ease through menopause more comfortably. Lifestyle changes are not only beneficial for menopause, but it also increases the overall health of a woman. It is important that we encourage our consumers with disabilities about the importance of a healthy lifestyle, so when the time comes for change, they are already adapted to a lifestyle that attributes less risk and complications during menopause. It can take some of our consumers longer to adjust to change, so it's better to start practicing these healthy techniques at an earlier age. Different vitamins and herbal remedies have also been recommended as effective. Black cohosh is an herb that is used as treatment for a number of health issues, including menopause, PMS symptoms, menstruation, and acne. For menopause, black cohosh is used as treatment for hot flashes, irritability, mood swings, and sleep disturbances. There are not many side effects to this herb, and it is generally known to be safe, which is why it is so popular among women. Lavender oil can also be used to induce relaxation and improve mood. It can also be used to improve sleep quality and calm the body. Rubbing 1 to 2 drops of diluted clary sage oil on the back of the neck or feet have also shown to reduce hot flashes. Clinical tests have shown that it could even be more potent than serotonin. Peppermint oil can also be used to reduce discomfort by reducing hot flashes and pain muscle. Basil oil contains a similar component to estrogen and can aid the body in adapting to changes of estrogen levels. There are many other oils that can be used to combat menopausal symptoms, and some are even used together. Aromatherapy was another thing that can help with psychological symptoms such as anxiety, depression, and mood swings. We discussed earlier how soy products contain estrogen, which is greatly depleted during menopause. Taking vitamins such as vitamin B12, vitamin E, vitamin B6, and vitamin D are also effective for an overall boost of health and assist with complications of menopause, such as osteoporosis and heart disease. Another procedure that can be performed is acupuncture, which is a traditional Chinese medicine technique. There is a video for this. I don't know if you guys were going to be able to hear it, but I will try to play it. Okay, so we're just going to skip all the videos through the presentation because they are not working. In this video, it was just a firsthand experience about this woman. She gets acupuncture done, I believe she said weekly, to help with her hot flashes, and according to her, it has decreased them dramatically. In the video, it mentions that during acupuncture, endorphins are released, which is the body's natural painkiller. It's been shown to be very effective in treating hot flashes, anxiety, depression, and joint pain. The one thing that was noted in the video is that it is an ongoing process, so in order for it to be effective, it has to be maintained. One session will not eliminate or reduce symptoms long term. So next we're going to talk about hormone replacement therapy. The most common type of HRT uses both estrogen and progesterone to balance a woman's hormone levels. Estrogen is given regularly while progesterone is added occasionally. The combination of the two prevent overgrowth of the uterine lining. Estrogen-only therapy is usually just given to women who have lost their uterus. Progesterone-only therapy is not prescribed very often as it doesn't provide significant relief. Generally, the use of HRT is for short periods of time, usually 3 to 5 years, as long-term effects have shown to have some risks. Like I said, there was a video, but it's not going to let you guys hear it, so we are going to skip it. But Dr. Green is the guy in the video, and he discussed that HRT does have some risks associated with it, such as heart disease and breast cancer. However, with additional studies that have been shown, if you take it for short periods of time, the risks diminish greatly. And they've actually been really, really effective in treating menopausal symptoms, especially severe hot flashes or night sweats. There was another study published in the journal JAMA conducted by Joanne E. Manson, and she found that women who took some form of HRT for approximately 6 to 7 years were no more less likely to suffer from stroke or heart disease than people in the placebo group. So overall, the effects of HRT have been shown extremely effective for women with menopausal symptoms, such as those hot flashes and night sweats, and the risks associated with the treatment are minimal when taken for short periods of time. Lastly, we're going to talk about an avenue that can be very beneficial to women going through menopause, which is counseling therapy. Many women go through life knowing that the time will come when their bodies will go through a drastic change. This alone can cause many women to feel anxious, depressed, or fearful of the unknown. There are a few different types of counseling therapy that a woman can benefit from, including cognitive behavioral therapy, psychodynamics, and person-centered therapy. Cognitive behavioral therapy encourages women to identify and change negative thoughts and beliefs that they are feeling. Psychodynamics is a therapy that identifies repressed behaviors and emotions and focuses on a patient's subconscious. For example, if you had a negative view of menopause because your mom had a hard time with it, or if you may have experienced a traumatic event during childhood shaped around menstruation, this therapy is used to work through those issues and provide a person with a different perspective. Person-centered therapy relies on the patient to improve their life and their views. The client decides what is wrong and how they should cope with issues as the therapist encourages and listens. Many of our own consumers with disabilities take part in talking with a counselor, which may make for an advantage as the time of transition occurs. The rapport with the counselor is already created, which makes for effective communication and trust. Not one therapy is better than the other. However, it is up to the woman herself to acknowledge the most beneficial route to cope with the changes of life. So I know we covered a lot of information today, and I apologize for those videos not working, but I hope that you all have a little better of an understanding of menopause and how to appropriately assist our consumers when dealing with this drastic change in life, because again, it is something that is not discussed with our consumers. It's often overlooked even by doctors. So being their advocate and being on their team and encouraging them to get the information is will be super beneficial when this time comes. So if you guys have any questions, I will be happy to see if I can answer them for you. Let's see. And then we will send this PowerPoint out to everyone that's attending the presentation, and the link to the YouTube videos are embedded, so you guys will be able to watch them on your own. So if you guys have any questions, please feel free to type them into the chat box to your right. Okay, I'm just going to give a couple more minutes to see if any questions pop up. Okay, I'm not seeing any questions pop up. Again, the PowerPoint will be sent out to everybody that attended, and the videos in the presentation that we weren't able to see will be sent to you as well.
There is a question about the certificate of attendance, and everyone will receive by email some sort of an announcement saying, hey, thanks for participating in today's session. There should be a summary on that email that kind of is like the introduction to what this was, similar to the advertisement that went out about it. So you should be able to use that to turn into your respective agencies for your credits for the training. So please look for that. It may not come immediately after this, so please give it about 48 hours. Watch for the email. You can use the email.
Thanks, Joy. Okay, thank you guys again for attending, and if you have any questions or anything, feel free to email me. I don't know if you guys have my email, but I'll try to answer any questions that you have. I'll put my email in the chat box just in case. Have a great day, everyone.
Thank you, Kayla.
Thanks, Carrie.